We are joined now by Dr. Amesh Adalja. He's a senior scholar at Johns Hopkins Center for Health Security at the Bloomberg School of Public Health. Dr. Adalja, let's start with the Delta variant. An estimated 10% of cases here in the U.S. are that new variant. That's up from 6% the previous week, and 99% in the U.K. Nearly all the cases are this Delta variant. What makes this strain so dangerous?
What makes the strain more dangerous is that it's accumulated several mutations that allow it to transmit more efficiently from person to person. So when you're in a situation where there is a group of unvaccinated individuals or a county where the vaccine levels are low and there's not much natural immunity, this can really take off and spread much faster than we saw with the original version of the virus or the UK Alpha variant. So this is something that we need to stay ahead of to avoid, things spiraling out of control in unvaccinated populations. I don't think it's going to be the same as what we saw in the spring or what we saw even in the winter, but for an unvaccinated person, the individual risk is very, very high.
What about those who are vaccinated? Just how effective are the vaccines, the Moderna, the Pfizer, the Johnson & Johnson, against this Delta variant?
This is the good thing about our vaccines. They are some of the most highly effective vaccines that we've ever developed as a species. And when you look at the Delta variant, people that have had both doses of the Moderna and Pfizer vaccines are basically virtually completely protected from this strain. So whatever happens is going to be something that we can prevent by getting more vaccines into people. We don't have all the data on the J&J vaccine, but I suspect it is similarly protective against this variant, but we're looking for more data for the J&J vaccine.
Doctor, the president set a goal of 70% of adults, American adults, to be vaccinated by July 4th. Right now, as we mentioned before, we're at 45% with one dose and 53% fully vaccinated. What do you believe can be done to boost those numbers?
We have to make it as easy and convenient and as normal for people to get vaccinated as possible. Unfortunately, we're kind of hitting this wall of vaccine hesitancy where the people who wanted to be vaccinated have been vaccinated already, and it's a lot of effort just to get a single dose into people anymore. So I think what we have to do is make this something you can get anywhere. You don't need to have an appointment. You don't need to put your Social Security number or your insurance information into some website. You should just be able to go and get it at the subway, on the beach, wherever you might be. We also, I think, need to ask, can we get these things fully approved? They're all approved on what's called an emergency use authorization. And one of the talking points for the people who are kind of spreading vaccine hesitancy is these aren't fully approved, that these are somehow experimental, which they're not. But I do think the FDA giving these full licensure to the Moderna and Pfizer vaccines would push doses a little bit farther as well.
Okay, Dr. Amesh Adalja, thank you very much.